For the record, today is January the 25th, 2026, and it's just a few minutes after 5 o'clock Eastern Standard Time. And someone invited you to this presentation because they cared about you. They thought that there may be something here presented here today that could make a difference in your life or in the life of somebody you care about. And it is a true statement that there are millions of people who are dealing with thyroid problems. And we're going to talk a little bit about that today. But I'm not the expert on this. You're going to be hearing from the world's first radiation biology PhD, Dr. Kedar Prasad. So we're looking forward to his comments on this. We'll introduce him to you in just a moment. But keep in mind, as we have discussions like this, as usual, you have to be aware, and we have to, by law, tell you that the FDA has not evaluated these statements. And testimonials that you're hearing are anecdotal. And you may hear some testimonials today, either firsthand or recorded, of individuals who had very interesting results in using some of Dr. Prasad's formulas. And they're saying that certain things happen to them as far as their thyroid and overall health is concerned. So we can't wait to hear that. But testimonies are anecdotal. Results are atypical. That means that what happens to one person may or may not happen to you. So neither the Healthcare Support Association of America, Engage Global, Dr. Prasad, Jonathan Jones, or any of the authorized representatives are making claims that any of the supplements that we talk about will treat or cure any disease state. This presentation is for information and educational purposes. Solamente. It is not intended to be a substitute for a visit to your doctor. We strongly recommend that you seek the competent medical advice of professionals that you trust when it comes to your health and well-being. But I guarantee you're going to hear information that you can take into consideration when making decisions about your health and well-being. And that's the reason for sharing this information. We want you to have something else that you can give thought to. Now, wrap your mind around what you're looking at right now. 20 million Americans living with thyroid disease. 5 to 8 times more women. Women are 5 to 8 times more likely to develop an issue than men. And that's kind of sad. That's really depressing just to hear that. 60% of the women are unaware of their condition. 1 in 8 will develop the condition in their lifetime. And you can see some of the symptoms there: fatigue, weight gain, mood disturbance, brain fog. And there's probably a whole lot more, but Dr. Prasad will help us
just finna say, I'm sick of that
clearly here
calling
in
my
just a moment.
messes. And you've
Now,
been
in
on
case you're
that
wondering,
Zoom. You ain't got nothing else to
Prasad
do.
is, if you're not, if we have not muted you, just keep in mind, folks, that when you are, if you're not speaking in the presentation, just remember to mute yourself when you step off. We want to encourage you to make phone calls. So contact anybody that you can think of and let them know about this presentation, because we're all about to hear something from Professor Prasad. See, not only did Dr. Prasad set the record because he was the first radiation biology PhD in the world, he also became the professor at the University of Colorado School of Medicine, and he did that for some 30 years. And he was funded by the Congress, Department of Defense, and I think NASA was somewhere involved in the clinical studies and the development of this product that Dr. Prasad put together, this formula designed specifically for the military that we now have access to. Dr. Prasad has published, authored or co-authored more than 33 books. I think it's around 35 or 36 now, and more than 250 peer-reviewed publications. And his products that he's formulated have 10 U.S. patents on them. So Dr. Prasad is eminently qualified to discuss this subject, and we're so happy to include Dr. Prasad in our discussion right now. So Dr. Prasad, thank you very much again for joining us, and we very much appreciate your being willing to join us on days like this when we're having presentations like this. Thank you very much for taking time out of your schedule.
Thank you, Jonathan. I always enjoy being with you and with my engaged family, and I can do whatever I can to help you on this issue.
Well, it's pretty clear to us that you can help us. I got one really quick question for you first, um, before we get into the presentation.
Mhm.
Those statistics, is that really true?
It's true. I think it is true.
So we're talking millions of people and mostly women that
Yeah,
have this problem.
yeah,
Wow.
woman is more sensitive.
And that's mind numbing for us, Dr. Prasad. Um, I do have one other little fact I want to share, that, and I want your opinion on this too, because some of the research that I did indicated that the food that we're eating just does not have all the nutrients in it that it used to have. And for many years, we kept saying that you could eat an ear of corn back in the 1900s, and you have to eat almost 20 ears of corn to get the same amount of nutrients today. Now,
Yeah,
is it safe to say that we just are not getting the right kind of nutrients in our food today?
yeah, that's very true. I mean, we eat it, and even corn, like I was not aware of. But any times you grow in a soil, and if soil is contaminated, it will come up in the fruits or vegetable or whatever you are eating. I love corn, the way
Yeah.
it's 1900 one, but here my wife brings corn once in a while, but it's not as yellow as it used to be.
And I think that's the thing. I still remember my first experience in becoming aware that it was not as nutritious. I spent some time, Bernard and I, we were volunteering up at a farm that grew all the food that we ate was all grown right there, organically produced, the livestock, everything.
Hmm.
I came back home to visit my mom, and she served me some corn. She just got it from the vegetable stand, and I kid you not, Dr. Sai, it tasted like absolutely nothing. My taste bud had just completely reset. It tasted like nothing to me. And
Mm.
so I came to believe that this is true, that we're just not getting what we're supposed to get in our food anymore.
Yeah, in all food, it's just not the corn.
It's not just the corn. Yeah, it's not just the corn. Now, please go ahead and just tell us then, how is it that that leaves us vulnerable to this oxidative stress issue?
Oxidative is because of poor diet, environment, and lack of exercise that is common to all chronic diseases, and uh, and especially in case of women, for example, high incidence than men. I don't know for sure, but could is it related to loss of estrogen as you grow older? Woman loses estrogen at a much earlier age than men loses testosterone. And so I have to do some more research on this issue. But facts remain that no matter what, oxidative stress and inflammation contribute to, major contributor to the all human diseases, including thyroid disease. And of course, as you know, that other factors are there too. But at least oxidative stress and inflammation are the major one.
Mm. So hyper is what leads to this Graves' disease, and hypo is
Yeah,
Hashimoto's. You wrote a book on Hashimoto. That was one of your books, isn't it, right?
I don't know. I don't remember I've written it. No, I may have mentioned it, but I don't think I have a separate book on this. I don't remember it.
Okay, yeah. Well, I may just be remembering something vague. I don't have a list of all of your books, but I intend to get them all. I intend to collect them all. So
Yeah.
I will have them in my possession at some point. So the thyroid is the thing that's being attacked here.
Yeah, again, inflammation, and sometimes for whatever reasons, thyroid area gets more oxidative stress and inflammation, and also the immune function is disturbed. And as you know, immune function can also affect almost anything. I mean, but sometimes it happened to be accidentally thyroid at that time was more vulnerable than say any other organ. So you got to hit the thyroid disease. And
Mm-hmm.
sometimes, statistically, it is a chance because oxidative stress inflammation is in every place. But sometimes it is in a localized area, whether it is eye, whether it is a thyroid, and there it is much more. So there must be some other regions that we don't know about it, why it affects thyroid, but not any other part of the body. This is very important that we have to understand that these are main, even though it's a major cause in thyroid, but these two, oxidative stress,
Hmm.
inflammation, involved in Alzheimer's disease, in immune function, everything else.
That's interesting. Yeah, because it's radiation, and I understood that glutathione is one of the things that would protect
Yes.
the other thyroid. In fact, I know a lot of other companies claim that they have glutathione enhancement product, but your product, your formula, has a very specific benefits to the entire immune system.
Yeah,
Um,
because the N-acetylcysteine, it increases glutathione level, but only one. But if you
mm,
don't have other component, and so, for example, in a macro daily, we have mechanism of stimulating the glutathione level. One is N-acetylcysteine, another is alpha lipoic acid,
mhm,
which also increases the glutathione synthesizing agent.
mhm.
So you have a more glutathione than just using N-acetylcysteine. So single agent in this case is okay to reduce, have some effect, but not the optimal effect.
I see. And you have what do they refer to them as exogenous antioxidants that you bring into the picture also.
Right, exactly. And so all this combination is very important to protect all parts of your body, immune function, thyroid, and any other, Alzheimer, you name it, brain, heart, everything.
Hmm. Hmm.
And
It
the reason
says,
is the same, micro daily that we have, it will be the only agent because to reduce oxidative stress and inflammation at the same time,
hmm,
have to elevate both antioxidant enzymes and antioxidant compounds like vitamin C and E. But no other agent can do it. If you use just N-acetylcysteine alone or vitamin C alone, it can do anything.
right. So this combination, this particular formula is the
Combination, this is our only product in the marketplace that can do both, increases the antioxidant enzymes as well as increases the antioxidant compound. And both
mhm.
are equally important in reducing oxidative stress and inflammation.
Okay. So that sounds fair enough and easy enough for us to comprehend. What about the gut?
Yeah, gut again, is most in medicine, this is the most neglected area. And nobody doctor will ever ask you when you go for a doctor, how's your gut?
Yeah.
But it is very important that intestinal dysbiosis means that number of harmful bacteria increases and number of beneficial bacteria decreases in the gut. When that happens, the harmful bacteria will produce a lot of toxic chemical, including pro-inflammatory cytokines. Not only that, intestinal dysbiosis, if you are going through any kind of therapy, it will interfere with the therapy and increases their potential toxicity. And this has been demonstrated when they did a study in combination with radiation and chemotherapy in cancer patients. So it is very bad. It is involved in the initiation and progression of all human diseases,
Wow.
including thyroid.
Wow. Dr. Prasad, so you're saying that a person could be being treated,
Hmm.
by a medical professional, doing all the things that they're supposed to be doing, but
Hmm.
their gut could be so bad that they could basically not be getting the fullest
Result,
results,
yes,
the best
yes,
results from even the
yeah,
treatment that they're getting,
yeah, yeah.
just because they're not paying attention to their gut.
Not only result, it will the disease will never go away.
The disease won't even go away. Wow. Yeah. Well, it's been said that 80% of the immune system is in the gut. So if you don't pay
Yeah,
attention to that, we got nothing. We got nothing. Now, last time we had this discussion, you mentioned both omega-3 and collagen peptide as being
yeah,
supportive in this whole thing with the thyroid.
yeah. And the reason is because, for example, omega 3, omega 3, for example, is very important for brain function, for heart and for other whole body's function. It is considered a absolutely essential fatty acid that our body does not make it. If it is essential fatty acid, it affects all organ. And what happens if you are not taking any antioxidant like our product, and your body has a high oxidative environment, then omega-3 will be oxidized and become non-functional.
Oh, wow.
And so
Wow.
then you have to, if you have that, you have to replace it with a good one. And that's why
Wow.
we have omega-3
You're
daily.
talking about rancid fish oil,
Yeah.
rancid fish oil in your body. Wow.
Yes, yes. So if you are not doing anything for your health, not taking macro daily, not taking anything,
Mm-hmm.
omega-3 can be destroyed.
Mm-hmm. Mm-hmm.
And then you will have all kind of issues later on.
So it's
And
one of many things
yeah,
that's important to keep your body in balance. And what about the collagen peptide here?
collagen
It looks like a
peptide.
binding agent here, looks like.
Yeah, collagen is because collagen peptides. First, you have to know about collagen. There are the 30%. Can you believe that? There 30% of total body protein is nothing but collagen.
Wow.
That means it is present in all organs,
Wow.
including thyroid, and you name it, eye, brain, heart, every place.
1/3 collagen.
One collagen, and that's 20 different types of collagen.
Mm-hmm.
Number one, number two, number three, there's 28 different types. And each organ have their own type of different types of collagen.
Mm-hmm.
And each organ has a genes to produce their need for type of collagen that
The
they need.
right, the right type of collagen. So that's why you put in your formula the peptide so that
Yeah,
the body can use the gene function and make
yes,
the correct
yeah. When
the collagen where it's needed.
right, when peptide goes to your stomach, they get all converted to amino acid, and amino acid get absorbed. Organ picks up the amino acid, and then they start making their own type of collagen that they need.
Mm,
They
mm,
different genes, different organ, and so this is very. That's why we have collagen peptides,
mm-hmm.
and so there was a study done in a 60 years old individuals, and they were having some cognitive function, memory loss problem, but had not have Alzheimer's disease. And so this physician started said, well, he must be aware of the collagen issue of collagen, and so he said maybe there is some loss of collagen. And loss of collagen is always, you can see in the skin, but you don't see in your brain.
Right.
So he did an MRI of the brain so that you can see that. And he found that certain area of the brain are deteriorating.
Oh, wow.
And then he said, well, could we really, is it possible that it is related to collagen? Because collagen is decreasing it. So he put person on a collagen peptide for 90 days and repeat the same experiment. When he saw MRI, he saw, oh, it is dramatically improved the structure. And also, memory loss is gone. So now he's in a good shape. And so I think
Hmm.
that further demonstrated clinically in human. There are a lot of animal data, so sometimes animal data does not reproduce in human study. But in this case, it was human study that showed. Even people have found it that in hearing disorders,
Mm-hmm.
ear has four different types
Mm-hmm.
and of collagen, and they all is very important for hearing. And if you lose there, then you get slowly less and less, and you become deaf.
Mm-hmm.
And so, same thing could be thyroid. Thyroid, I have not looked in a collagen issue with respect to thyroid, but I will look maybe next time.
Mm-hmm. Mm-hmm. That's good. I'll flag you
And
about that
in
on
general,
next time.
for your general health, if you are taking core 4, it covers everything.
Mm-hmm. Mm-hmm.
All
Interesting.
the events that contribute to your sickness,
Right.
whether it is a thyroid disease or whether it is Alzheimer or Parkinson, everything will
Mm-hmm.
be reduced.
That's interesting. You
Because
mentioned you mentioned at one time when it came to hyperthyroidism
Mhm.
to maybe avoid collagen. Is that still hold true? So hypo, you should take it, but hyper, you said one time to avoid it.
I think you have to give me a chance to review again because
Okay.
I'm not sure.
Okay. That was just a note that I had from the past, and we'll put the word out for everybody. But it was based on some research that you had done.
Yeah, yeah. I think, this could be true. And for the time being, I think whatever you are suggesting is
Hmm.
maybe true. But I will reconfirm it next meeting when we have, even though
Okay.
that meeting may be unrelated, but at least on the issue of this one, I
Yeah.
will study and let everybody know. But for
Okay.
the meanwhile, follow what you have suggested,
Hmm.
that may be true.
Right. Yeah. Okay. So the person who was hyper
Yeah,
to avoid it.
yeah.
Um, GLP-1 and GIP, because a person who is dealing with thyroid issues will often be concerned about their weight. So how do activating these two hormones play a role?
Two hormone is very important in terms of reducing weight. First, it make you not eat too much because it slow down the emptying of your stomach, and so I think it does. And of course, the one of the reason why you start gaining weight is the accumulation of glucose.
Mm,
And so GLP-1 and GIP, both GIP is less than GLP-1, uh, will also, if you activated them, then glucose metabolism occurs and then you don't gain weight. And
hmm.
our formulation also have two herbs that does not affect GLP or GIP, but it prevents the formation of new fat and eliminates the existing fat in your body without any GLP or GIP.
Wow. Okay.
So our
Oh.
product, the GLP-1 and GIP, is going to be very good one. Another reason that no other product have it.
Hmm.
That see GLP, if you don't get a inhibitor like DPP4 enzyme, destroy GLP-1 and GIP. And within 2 minutes, suppose they get produced, within 2 minutes they will be destroyed by this enzyme DPP4.
Hmm.
And so until you put some kind of inhibitor of DPP4, you won't get a maximum benefit of the uh,
So
uh,
the collagen peptide is going to be very helpful. Taking the collagen peptide along with the
yeah,
GLP-1
yeah,
boost,
because it has
that's important.
yeah, that is two ingredient. The uh,
Hmm.
amla extract and white tea extract was added for different reason in the beginning.
Yeah.
It inhibits collagenase, which destroy collagen. The
Hmm.
enzyme degrades collagen, and these two inhibit it. But later on found they also inhibit DP4, but a small amount. So a new product that coming in, the new product that will be coming in the market, we have an additional three herbs which inhibits almost 90% of 90% inhibition of GLP-1.
Yep, yep, yep. That's beautiful. That's
Yeah,
beautiful.
so
Well,
no other
that's
products have that. No other product have the inhibitor
well,
of
no one else has got Dr. Prasad. So that's the advantage that we have. We got a leg up on folks with this one. So and I'll tell you, Dr. Prasad, I love the collagen peptide.
me too.
I will not go a day without it. I find that it's
My
just
son also, Che, very religiously you take also, just like
hmm. Yep. So I think you knocked it out the park with that one. So, but we had some folks, Dr. Prasad, that had some interesting results
Mhm.
with your product. I sent Liz Henry a message letting her know that we were going to ask her to tell her story
Uh-huh.
because she was dealing with this Graves' disease, and she focused her attention on your formulas, and
Hmm.
basically did what you said to do. And
Hmm.
so I was going to play her recording, but I know she's here. So I think it might be just a good idea to just let her just
Sure.
tell her story about how this went, and love to hear your comments, Dr. Prasad. Any analysis you can do on this would be very, very helpful. So Liz, tell us what happened with you. And
Okay, just one moment. Okay, Mr. Bosworth?
oh well, okay, I think we got put on hold, Dr. Prasad.
Yeah, it looks like she has not put yeah.
Uh, but
She
that's
has
okay.
removed that thing.
Well, what I'm gonna do, I'm gonna play her story is what I'm gonna do, and then she can come back in and interrupt it. So that I'll take care of that. So, all right, Liz, we're gonna come back to you in just a minute then.
First, she has
And
to remove her audio. Audio is still closed.
mm-hmm.
I'm sorry.
Okay, now I got it.
Okay.
Yes, it was in 2022 that I was diagnosed with hyperthyroidism, Graves' disease, and I was told that it was life-threatening. That they didn't know that at first, because they gave me the mildest form of the pharmaceutical on the market, the safest, and it turned out that I was toxic. In 4 weeks, it took my white blood cell count down to 2.8.
Wow.
Also, my red cells and platelets diminished greatly in
Hmm.
about 4 weeks. So I was told by the endocrinologist, you can't take that anymore. I said, well, what am I going to do? He said, go to the hematologist and see if they can give you something to boost your white cell production while you take this medicine, because you could have a heart attack. You could have your hormones all dump at one time. Or you could, if we tried to take the thyroid out, you could have a heart attack on the operating table. So I was in a very bad situation. What I did to start with was change my diet. I did everything naturally that I could think of, um, to control the production of the thyroid hormone. I ran into a an Amish remedy. They called it hyper T. I did that too. So I was doing everything that I could do, but it just didn't get any better for a long, long time. And after it started trying to correct itself, it would just fluctuate. But when I learned about microdaily, I decided to take it. The microdaily, EMF, the probiotics, and the omega-3. I started taking it, and I was not taking anything other than the basic or the minimum dosage. But after about 6 weeks, my numbers were normal, not just the hormones, the thyroid hormone numbers, but also the blood numbers, and they've continued to be so. So I'm no longer taking any of the methimazole. I don't even have to take the blood builder either. But my numbers have maintained for these 3 years now.
Wow.
Wow, thank you, Elizabeth.
Wow.
Thank you. Thank you, Dr. Prasad.
Thank
Well,
you.
Liz, that was
That's amazing me, even though I've developed this product, when we see the results, I feel so happy that my increase my life span by a few months.
no, we're excited to hear that, and that was worth waiting for you to put when you put us on hold there, Liz. So that's okay.
So sorry. I had two people
That's,
call me.
That's all right. That's okay. It's quite all right. It's important
that's
because
amazing.
that's what happens when you're a celebrity. Yeah,
Uh,
that's beautiful. So
Thank
Dr.
you.
Prasad,
That's amazing. I mean, nobody would have thought it.
mhm.
I mean, I would have never thought it when I developed all this product.
And
It is
you
knowing
invented the
fully
stuff.
that increased oxidative stress and inflammation are involved, but not many people pay attention to.
So,
The
but Dr.
disease,
Prasad, her blood numbers all returned normal also.
that's
So
amazing. That's amazing to me. Because again, if you have oxidative stress, they can affect every organ, every cell in your body. And so that is not very surprising. But it is surprising for me, but
yeah.
you don't expect that. And so I think, it is amazing to see that people are having it. good quality life is very important. And so not only for against the thyroid diseases, but also against all chronic diseases. If you just take a core 4, plus if you have some sleeping issue or some heart issue or something specific, then you can order a specific boost that we have. But otherwise, for general purpose, core 4. And suppose if somebody can't afford core 4, at
Right.
least core 2,
Right.
microdaily EMF and the probiotics is a must for good health for a longer period of time.
Right. Understood. Understood. Well, it's somewhat mind-numbing to contemplate what people are experiencing with these formulas.
Yeah,
I don't know if we have Angelique Greer is on the call right now or not, but I asked her, I think it was about a year or so ago, to share her thyroid story, and she said, "What thyroid story?" And I said, "Angelique." I've only known her as Kathy. I said, "Kathy, the reason you started taking microdaily was because you had a thyroid problem." She said, "Oh yeah, that's right. I forgot I had a thyroid story." And I said, "Okay, well then forget telling your story. Just relate this conversation that we just had. You forgot you had a thyroid story." So that's what happened with Angelique. She may not be here. Oh no, Angelique is on. Angelique, can we get you to unmute? Are you in a position where you can share your story?
I can unmute. I wasn't expecting to be called. I was just sitting there listening.
I didn't go on blast, but I had to just tell people you said that though. I forgot I had a thyroid story.
Yeah, well, what I was diagnosed about 30 years ago with thyroid, where it's low. And I was always struggling with swollen hands and feet and lack of energy, but didn't know what it was until about when I was finally diagnosed. But then back then, you couldn't find any information on what to do. They just want to give you a prescription and very little information and just say you're going to be taking this for the rest of your life. That was about it. And then Jonathan, oh, my husband, he got sick. So we called Jonathan because we found out that he knew about, well, we didn't know it was micro daily. So we called him to see what you got. And so I decided to try it for the thyroid issue. And that was about 6 years ago. I think it's 6 years now. And it got rid of all the lack of energy, just the regular, there's so many things that you feel when you have a thyroid problem that you don't know is related to the thyroid disease, just aches and pains, and it's just lack of memory, all kind of things. But it got rid of all of those um problems. No more just weird pains. I have energy. All of my hair did not fall out. I thought it was. I thought it was gonna all be gone soon.
And it stopped the whole process. And how is it that you were out there running around playing football on the beach, I think you said?
Yes. So we were at the beach and there was these young people playing football that I was with. And I said, you know what? I don't want to be sitting on the sideline watching this. I'm gonna go and play ball with them. And you're playing in sand, and I'm trying to catch the ball, trip and fall, jump back up and start running again. Some of the people that were watching, they said, if I had a fail, I would have never been able to get back up. So yeah, it's amazing to me. I have energy and can do a lot of things. And other people around me, they said they can't do any of this. But I know it's micro daily.
Did you tell them that what you are doing and so that they can also take it or not?
Yes, I did, but people are so skeptical.
Yeah, I
Skeptical.
agree. Yeah, I
A
agree.
few people have been trying it. I did get a few people.
Well,
In fact, I had told you about my sister that's in the hospital now,
mm,
and she's taking it.
mm,
And the doctors are amazed at how fast she is. Um, she's improving, and they
well,
keep going. Wow,
mm.
she's holding her head up. She's the one with the muscle disease,
Oh,
and
I
they're
see.
just amazed at how well she's improving. So yes, I've been
Mm.
telling the people about it.
Good, good.
Yeah, well, don't stop. And we're going to be looking forward to hearing parts 2, 3, and 4 of your stories because you
Yeah,
and James have some very
yeah.
interesting stories that you're sharing. So thank you. And Miss, I forgot I had a thyroid story, Angelique Greer.
That's funny.
And we had one more. I don't remember Chris's story, but I don't think Chris is on right now.
Okay.
Jeff, do you this may be someone that Jeff knows. Jeff, do you know anything about Chris and his story? He had was struggling with Hashimoto's. Yeah, maybe I'm pretty sure we have it on recording someplace, but there may be some other folks that are on here right now that are dealing with or have had results with thyroid issues. If you want to share your story now, go ahead and just raise your digital hand, and we'll turn around and come back to you and and hear your story. Or if you have some questions about thyroid, we'll be looking forward to answering those toward the end of this discussion right now. But this is what you were talking about, Dr. Prasad, the core four.
Hmm.
And so folks need to understand that it really is this simple. And Dr. Prasad mentioned that, if budget is an issue, then all you want to do is focus your attention on the two on the left. So, but the person who invited you, they can help you to figure out what will work best for you. But if you want to give yourself the full complement, the best options, then this is where you want to go. You want to go with the entire core four. So, Alfreda, you have a thyroid story you want to share with us?
Well, just recently, I was referred to an endocrinologist because they thought that my parathyroid was malfunctioning, and because my calcium levels were high, and I had talked with Dr. Prasad before about that, and so it was just interesting. You have to really because I think a lot of people are getting misdiagnosed also, saying they have thyroid issues and they don't. Because when I got, and they were talking about I was going to have surgery to remove the parathyroid, or, the bad ones. And when I got to him, it was interesting. He said, he interviewed me and looked at the tests, and he said, you know what, your parathyroid is normal. And years and years ago, I had half of my thyroid removed, and when they biopsied it, cancer was just about to start. It was the size of a pin needle, so that was good. I had nodules and half of it removed, and so I've never had to take anything for thyroid. It's been normal. But the interesting thing that he said, for my high blood pressure, I was taking chlorothalidone. And he says to me that the chlorothalidone is a calcium blocker, and he said that's probably what's causing the calcium to go into your blood where it wasn't, instead of my bones. And
Mm,
so I thought that was kind of interesting. It's like, do these
wow.
doctors ever talk to each other when,
Wow.
they're diagnosing a person? So, you, you know, I stopped taking it.
Wow.
So, and I just met with my primary, And so I have to take another blood test to see what's happening now. But it was like, they was my rheumatologist was scheduling me for a surgery, and for thank goodness the endocrinologist was honest. I will say that, and he said there's nothing wrong with your thyroid.
Mm-mm-mm. Or it was something wrong at one time, and all of a sudden, what you were doing made it improve. So that's it. That's a good thing. Thank you for sharing your story, Bernardine, our co-host.
Mhm.
You had another
Yeah.
comment or question on the thyroid?
Well, my wife, as you're probably aware of, my wife has a thyroid issue. In fact, she has a non a goiter that is still there, but my wife actually developed a goiter in 2019. We still didn't know where it came from. We thought it was medically induced, but the doctors kind of looked at her, and she's been having quite a bit of um, confirmed with the doctor, and they said they don't really see a reason why she should have a goiter. Of course, goiters can be also related to stress. Now, I do know that she is under a lot of stress. So what we did was we tried. We went on with Dr. Prasad products. Dr. Prasad had been giving her some advice. The one thing that's encouraging is that the goiter is not growing anymore. It's not getting bigger and bigger. But we're trying to make a decision as to how to shrink it, especially when stress is related. Then you can get about all it needs, but it's something that perhaps that goiter may not react to. So there's not a guarantee that a goiter is going to disappear, but even if you can stop it from growing, that's a huge factor.
Yeah.
I just wanted to make a comment on, and I need everybody on here to understand. Right now on this call, it's amazing. It's 128 people on this call. And every Sunday, Dr. Prasad come on and actually give information that millions need. But for some reason, sometimes people are a little bit hesitant to invite people on these calls. And yet, I have been with the company now for about 3.5 years. And the one thing I have to say is I have had an immense amount of people that have had cancer, diabetes, dementia, heart problems that have turned around and actually thanked me with tears that I put them on these products, and it's turned their life around. And we're not really competing with medical. I want to say that again. We're not competing with medical. Why? Because our products can be taken with any medication. Sometimes doctors will say not to take it because they're not really familiar with Dr. Prasad and his products, and he's willing to talk to doctors on that. So as we mentioned this thing, I noticed a number of people say, oh, people, if you love your people, whether or not they're going to respond, let them know. And earlier, Angelique came on. The one thing Angelique did not tell you is that her sister that's having these medical challenges would not take Micro Daily for a year.
For
And then
years.
she got in a condition for years that she wouldn't take it. And now, within the last month and a half, she's in a life-threatening situation that she was not given hope. And all of a sudden, only a month and a couple of weeks ago, she got on these products, and things that the doctor said you'll never be able to do within a month and a half, she's doing. Now I can say that I'm a 30-year paramedic. I'm renewed even last year. I'm home on this paramedic as long as I can. I teach life support, BLS and CPR. That's what I do. I'm a 25-year firefighter retired. I'm only here, Dr. Prasad, because for the first time that I've seen, you've got a product that people can take it for 6 weeks and take it consistently, and we follow up and make sure they're taking it. I'm getting those incredible calls, and these people are on here. I'm amazed it's only 126 people with the millions that's dying from the conditions that we're talking about on this call at 5 o'clock. So I just wanted to throw that in there, Jonathan, because it's important for people to know that the medical system is crashing right now. If you haven't seen it, it is crashing. You can spend 10 to 15 minutes with a doctor, but you're probably not going to find out what's wrong with you. But when you can give your body all that it needs with the core four, and now you've learned if you got financial problems, use the core two. The very least anybody needs is the micro daily and probiotic. And I like something you said today, Dr. Prasad. You said that the Core 4 has been patented and designed to address all deficiencies in the body
Mm-hmm.
and give those cells everything it needs to have a fighting chance to battle these diseases. So I just want to thank you for these Sunday calls because it's a sacrifice to come on here. Jonathan, I know I kind of ventured off a little bit, but I'm listening to people, and I think people don't realize what they have in their hands. People, we have a wonderful product in our hands.
Absolutely.
All we have to do is get it into their mouth, their system, and change their life. Or as one movie said, change the stars.
Very good. Very good. Thank you. Thank you for your comments there, Bernard. Excellent. This screen, by the way, has a mistake on it. It says the retail price is $310. That's not true. The retail price for all of this, no, yeah, maybe that is about true.
Yeah.
Yeah, maybe about $315 or so for the retail. The wholesale price would be about $250,
It's a little
$260.
higher. That's the old price for it. The new
Yeah,
retail,
these are
I
the
think,
old
is like
prices.
$330. But
Yeah,
and of course the bundle with $199 went up to something like $207.
yeah, and it's unbelievable because Engage Global basically is subsidizing health.
Yeah.
So that's below the wholesale price.
Yeah.
So I would highly just recommend for anybody who's looking to to improve their health, especially with this thyroid or any condition, it doesn't matter what it is,
Yeah.
to do that. We did have one more hand that was up. It was
Sure.
Jones. I don't know if there's one of my cousins or what. I have no idea, but it was Jones. Your hand was up. Are you still there? It's just now it says Jones household, but not unmuting. So if you did want to, we want your question or your comment. Okay, well, if we have time, we'll come back. We'll come back to Jones or Jones household there on that. So you all heard Dr. Prasad make another statement there too, the importance of being physically active. We can't overstate that. Please don't expect a pill, lotion, or potion to do for you what you could do for yourself. So give yourself 90 days, talk with your whoever your healthcare provider is, get medical advice from whoever you trust, but try to get 7,000 steps in a day. And if you can't do that, just start parking as far away from the store that you go to as possible. Instead of trying to look for the closest parking spot, look for the one the farthest away. Increase the amount of steps that you're getting in for the day. Instead of taking the elevator all the time, take the stairs. If you can't go up the stairs, then go down the stairs. But do more walking, get as much in as you can, and your goal should be to get to the point where you're doing about 7,000 steps every day. But the core 4 is your ticket. And remember, that's the disclaimer that pops up there again. So my favorite slide, I think, is this last one, Dr. Prasad. Mm-hmm. It's just quoting Angelique again. What thyroid story? And that to me, that line will just go down in history as a classic for someone to be living their life, and no longer aware of a problem. Like I find myself, I had developed this limp and a pain in my toe. I'm just walking. I'm bending down. I'm standing up, and I'm not even cautious about it anymore, Dr. Prasad. Mm-hmm. So it's nice when things can just go away to where you just don't remember what your situation is. So don't let a chronic condition control your life. Take it back. Take your life back. And the core 4 is your ticket to being able to do that. And the person who invited you to this presentation, get with them. They'll talk you through getting the answers that you need to see exactly what's best in your case. Eunice has her hand up. You have a question, or are you going to share a story, Eunice? And if you can confine your question to the subject matter, that would be helpful. Eunice is not able to say anything.
Is that the same as Sharon?
Okay. Yes, I came on late, but I heard half of the story that Angelique or Hanji, whoever she is, talking about the parathyroid, and I have a problem with my parathyroid. The doctors they keep telling me that my calcium is always too high. And they are saying when they do the tests, they say it's normal, yet they are now saying that I am hyperthyroid. parathyroid. I have hyperthyroidism. And when I heard her mention about the calcium channel blocker that she has been taking for blood pressure, I have to pinch myself because I am on a calcium channel blocker too. So
Okay.
I am wondering what is this, because I don't, because I remember I was taking higher doses and I just gradually lower my doses until I am now taking 2.5 milligram of the amlodipine, and my calcium dropped a little. The doctor said she want to see it go. But at the same time, now hearing her story, I want to know because they were giving me 10 twice a day. And my feet swelling and all of that. I tell the doctor I can't do it. Then they go down to 5, still same problem, and the calcium was going up like crazy. And now I am at 2.5 milligram per day, and sometimes I have to take it twice. They say when the blood pressure is up, I should take it twice.
Understood. Understood. Well, here's what you want to do also, Eunice, is vitamin D3 and K2 is very important.
I am on it, and it's because I was listening to you, and because I have the micro daily, and they're telling me I took it. I don't know why I did that. I took it to the doctor and I showed her. I said, I'm feeling so energetic. It's amazing. And she said, no, you need to stop taking this because your B12 is too high. And so I said, what about my D3? And I understand that I should take D3 with K2, and I should be on magnesium. And I said, can you do a test for me, please, to see if I'm low in dose? And they did the test. Lo and behold, it came back that I am low. So I start, and then they still didn't prescribe any for me. So I start taking the vitamin D, the
Oh
D3
my
with the
goodness.
K2, and I am on my magnesium. So I said, you know what? I have to call Mr. Jones and let him know that,
That's
yes, I
beautiful.
want to know about, because I want to go back on my micro daily, because I just
Okay.
took it out this evening, and I sent you a message. I sent
Okay.
you a message,
Well,
yes,
we're
and
gonna be discussing that. So
please
um,
do.
make sure look for a call from me. Then we'll have this discussion
Okay,
and help you get through that, because folks need to be getting
yes,
about 10,000 units of D3, much
okay,
more than what they're recommending. But we'll talk some more about it. Okay. Thank you for sharing.
yes.
All right.
Thank you. Okay.
We're gonna sneak one more in here. Go ahead, Val.
Hi, question for Dr. Prasad. I have a friend in another state. She told me about 15 years ago that the doctor said she had too much calcium buildup in her blood. All of a sudden, she kept having stroke after stroke. She's up to her 15th stroke. I was visiting her the
Wow.
other day in another state, and I did look at a presentation some time ago how D3K2 tells that calcium to come out of the arteries and go back into the bones. But as far as our products, what would you recommend for her? Because she just recently had another stroke. This is getting crazy.
That's the core four. There's no
Okay.
question about it. She should be going on at least initially double the normal dose of micro daily along with the probiotic boost, and that'll start to reduce her oxidative stress. We've had so many presentations in here on stroke where folks have again, we keep saying that these are not treatments for or any disease, but many anecdotal stories of people saying that they had phenomenal benefits and have never had a stroke again. My sister, she takes double doses of micro daily now, and she had a stroke back in the beginning of COVID, and usually it will happen within 5 years. She's on year number 6 now, and she's got no problems whatsoever. So that's you don't have to stay up for long term, but go on the double,
Yeah,
for at least a
short
while.
term, yeah.
Mm-hmm.
Thank you.
Yep.
Appreciate that.
You're very welcome. Thank you for sharing. You're asking your question and sliding that in here. One last statement, Elizabeth. You shared your story early. We want to hear from you. You got a follow-up comment?
I have a new person of interest on this meeting. They want to know quickly if pumpkin is used in the boost, energy boost. We have someone who wants it, but the coloring or the flavoring, does it involve pumpkin? Pumpkin?
Dr. Prasad, do you know if there's pumpkin flavoring in the energy boost?
No, there are only 3 flavors: strawberry, and a what do you call? One
Pina
is
colada.
Yeah, so
Strawberry,
they,
pina colada, and grapefruit.
yeah, they didn't use
No,
any
no
pumpkin,
pumpkin.
I
and
don't think
they wouldn't use it for color at all anyway.
And grapefruity.
Mm-hmm.
Okay, we're aware that we just want to be sure.
Pina colada.
She's very allergic to pumpkin, so she
No,
wants to know if
there's
it
no
has anything to do with the coloring or anything like that.
There is no pumpkin.
Yeah,
Okay.
not for color. They wouldn't do anything for color anyway.
All right, very good. The label does says natural coloring and natural flavor.
Oh,
Yeah.
okay. Well, maybe so then. All right.
But it doesn't say pumpkin.
It doesn't say.
There you go.
All right. Well,
I'm
there's the
drinking energy
confirmation.
drink. While I'm talking, I'm drinking energy drink.
Okay, thank you.
Well, Elizabeth, Liz, thank you very much for sharing your story, Angelique, and all the others, Bernard. But Dr. Prasad, we can't thank you enough, sir, for your being willing to come on this program. And our guests are better for it every single time you push yourself and you make it here. So thank you very much again. Good night, everybody.
Good night.
Thank you.
Thank you.
Good
Night, everyone.
Thank you